Hafidang, good morning, happy Friday, welcome to the Office of the Governor. Today we will be proclaiming November as Guam Lung Cancer and Smoking Cessation Awareness Month. Before we begin, of course, I want to acknowledge the presence of the Honorable Joshua Tenorio, Acting Governor of Guam.
Good morning, everybody.
And to his left, Speaker Therese Terlahi, our Acting Lieutenant Governor of Guam. From the Department of Public Health and Social Services, our Acting Director, Peter John Camacho, and his Deputy, Terry Yogan. We can keep the applause coming. DDHS's Chief Public Health Officer, Catherine Nkau. Dr. Jolene Ugg, Pulmonary and Critical Care Physician, Medical Director of Special Services and Outpatient Care. Mr. Peter Cruz, Certified Nicotine Cessation Facilitator. Naomi Del Mundo, Guam Cancer Registry. Where are you, Naomi? That's over here. Joshua Dunn, Select Care Wellness Administrator, UOG Grant Air Route Outreach. Angelina Mummer, UOG Cancer Research Center. Dennis Almonte, Registered Nurse, Mountain Pacific Quality Health. Hannah Carlos, Guam Behavioral Health and Wellness Center. Anthony Jumovic, Guam Behavioral Health and Wellness Center. Kristen Hocock, Guam Behavioral Health and Wellness Center. Keep the applause coming. Kyla Aquino, Guam Radiology Consultant. Nadine Cepeda, Guam DOE Lead District School Psychologist. Rose Greeno, FHP HCD Administrator. UOG's Health Disparities Team, let's give them a round of applause. Thank you so much. From Public Health, we also have the Bureau of Health Care Financing Administration. We have Behavioral Risk Factors Rate Assistance Program, the Non-Communicable Disease Prevention and Control Program, the Guam Breast and Cervical Cancer Early Detection Program, the Health Disparities Grant Team, and last but not least, the Preventative Health and Health Services Block Grant. Let's give a round of applause. There are a lot of partners and stakeholders today, so thank you again for joining us here at the Office of the Governor of Guam. We do have some remarks before us. I want to start with remarks from our Acting Public Health Director, Mr. Peter John Camacho. Mr. Peter John wants to defer to Ms. Catherine Nkau, our Chief Public Health Officer.
Good morning. After the Acting Governor Joshua Tenorio, our Acting Lieutenant Governor Therese Terlahi, members of the 37th Guam Legislature, clinicians, community partners, colleagues, and our guest speakers. Today is the second year we commemorate November as Lung Cancer and Guam Smoking Cessation Month. Last October 31st, 2024, U.S. President Joseph Biden Jr. proclaimed November 24 as National Lung Cancer Awareness Month. Lung cancer in our island is the leading cause of cancer-related deaths. By ethnicity, Chamorros and other Micronesians had higher rates of death in lung and bronchus cancer than in the U.S. and the total Guam population. The CDC states that the #1 cause of lung cancer is cigarette smoking. This annual proclamation aims to bring awareness of the importance that lung cancer screenings are an important tool to help detect the cancer early, when it is most treatable. And as a reminder that if you still smoke, quitting smoking is the single best thing you can do for your lung health. The Department's Guam Tobacco Prevention and Control Program works to prevent tobacco-related illnesses by spreading awareness about the harmful effects of tobacco and nicotine use and offering the Brief Tobacco and Nicotine Intervention Skills Certification, which is an 8-hour workshop, and the Tobacco-Free Guam Quit Line. Quitting nicotine is hard, but we can do it. Our program helps spread awareness about the harmful effects of tobacco and nicotine by utilizing social media platforms such as Facebook and Instagram, movie theater commercials, and public service announcements. Last year, the program launched a social media series of 52 facts on tobacco and nicotine. We're launching a series of 52 facts for a stronger you, and that includes screening for cancer. We invite everyone to like our social media platforms. The more we know about lung cancer, the more we can help our community. The University of Guam has recently awarded a grant for the Artificial Intelligence and Machine Learning Consortium. Our department's Behavioral Risk Factor Surveillance System program is collaborating with a distinct team of researchers and community partners, namely Dr. Raizina Badalski from UOG, Dr. Nathaniel Berg with the Guam Radiology Consultants, and Dr. Pamela Peralta, Director of the Guam Cancer Registry, to predict lung cancer burden in Guam based on socio-economic data using machine learning while training UAG students in this field. With a comprehensive approach to prevention, screening, and treatment, we can end lung cancer as a public health problem. Last week, during Relay for Life, the American Cancer Society and the Pacific Island Partnership for Cancer Health Equity with the University of Guam organized a data walk on lung cancer data to bolster attention to the leading cause of cancer death in the United States and in Guam. This series of posters help our community learn about Guam's tobacco use data, e-cigarette use data, risk factors, and screening and testing guidelines. In closing, Acting Governor and Acting Lieutenant Governor, the DPHSS stands with you in the second commemoration of Lung Cancer and Guam Smoking Cessation Awareness Month 2024. The importance of smoking cessation, the importance of cancer prevention through early detection, lung cancer screening, and ensuring we reached out to our community on the services and information available to prevent lung cancer. Thank you so much.
Thank you, Ms. Catherine. I now want to give the floor to present lung cancer data, Ms. Naomi Damunda, Guam Cancer Registry.
Thank you. Hafade, Acting Governor, Acting Lieutenant Governor, members of our legislature, colleagues, family, friends, and survivors. Thank you to the coordinators for inviting the registry to speak about lung cancer on Guam. Over the past decade, lung cancer has always been in the top 5 cancers on Guam. Between 2018 and 2020, lung cancer was the second leading cancer on Guam, accounting for 16.5% of all cancers diagnosed. It accounts for 20% of cancers in men and 11% of cancers in women. We have seen an increase in new lung cancer diagnoses over the past few years. There was a 6% increase of new lung cancers diagnosed between the time frame of 2015 to 2017 and 2018 to 2020. The top 3 ethnicities affected by lung cancer are Micronesians, Chamorros, and Caucasians. Most lung cancers on Guam are diagnosed 55 years and older, compared to the US, where most of the diagnosed are at 65 years and older. The leading cause of cancer death in both men and women on Guam is lung cancer. It accounts for 31% in men and 23% in women. The Guam lung cancer death rate of 46.9 surpasses that of the US at 40.2. As we know, tobacco plays a big part in lung cancer, whether you are actively using or come across it secondhand. 58% of Guam's adult cancers are tobacco related, and that's not only lung, that is inclusive of all cancers. If you or someone you know is a long-time tobacco user, we advise you to talk to your doctor about screening. As we always say, screening saves lives. Again, thank you for everyone for your time and your support for the Guam Cancer Registry. And if you would like any more information on cancer on Guam, please call the registry at 671-735-2988. Thank you.
Thank you, Naomi. And I want to turn it over to Josh Dunn, lung cancer screening insurance coverage.
Hey, good morning, Acting Governor, Lieutenant Governor, and distinguished guests. As briefly mentioned, The AI-driven insights on risk factors from economic, behavioral, and social determinants for predicting lung cancer in Guam, the IRI project was awarded $500,000 for the Artificial Intelligence Machine Learning Consortium to advance health equity and researcher diversity, the AIM Ahead program, in the section of public-private partnerships to improve population health using artificial intelligence and machine learning. This innovative project has a distinct team of researchers and community partners. Dr. Badowski at UOG, Dr. Tamil with MedCognetics serving as the co-principal investigators, Dr. Berg with Guam Radiology, Dr. Peralta, Director of Guam Cancer Registry, Grace Verdalio with the Behavioral Risk Surveillance Survey, Monica Guerrero, Senior Planner at Guam Department of Public Health, all collaborating on this IRI project to predict lung cancer burden in Guam based on local social economic data, using this machine learning while simultaneously training graduate students in statistics and data science. This IRI project will link clinical and image data from those who underwent lung cancer screening at Guam Radiology with derived data from Guam Cancer Registry, Brephis, Guam Census to develop accurate lung cancer risk biomarkers that can identify individuals who will benefit the most from lung cancer screening. This can ultimately lead to a reduction in advanced lung cancer rates and ultimately reduce lung cancer mortality on Guam. Thank you.
Thank you, Josh. I now want to turn the floor to Chris Serler from the Department of Public Health and Social Services.
Hello. Acting Governor Joshua Tenorio, Acting Lieutenant Governor Teresa Terlahi, and all our partners, Hafaday, and good morning. The objective of Guam Medicaid is to provide accessible health care to low-income individuals and families, helping them maintain and improve their health. It focuses on expanding access to essential medical services and reducing health disparities in the community. By supporting health equity and improving health outcomes, Guam Medicaid aims to create a healthier and more resilient population. As mentioned, lung cancer is one of the leading causes of death in Guam, and smoking remains the single largest preventable risk factor. Quitting smoking and having access to lung cancer screening can make a profound difference. Through Guam Medicaid, eligible recipients can access low-dose CT scans, a critical tool for lung cancer screening. This scan is especially effective for individuals at high risks, such as those with a history of heavy smoking. Guam Medicaid recipients who meet the risk criteria are encouraged to speak with their healthcare providers to discuss a referral for this screening. Early detection is key in the fight against lung cancer, and low-dose CT scans can identify abnormalities at a stage where they are much more treatable. Additionally, Guam Medicaid recipients ready to quit smoking can avail of tobacco cessation programs on island. Guam Medicaid covers tobacco cessation programs, providing both counseling and medication to support people on their journey. We urge anyone who is eligible and struggling with tobacco use to take advantage of the resources available by our partners. Quitting smoking can reduce the risk of lung cancer, heart disease, and other life-threatening conditions. Let's continue to work together to protect our health, support our loved ones, and build a healthier Guam. Thank you.
Thank you so much, Chris. Again, this is a twofold proclamation to proclaim November as Guam Lung Cancer and Smoking Cessation Awareness Month. So I want to give the floor now to Mr. P. Cruz, Certified Nicotine Cessation Facilitator.
Hafaday, Acting Governor, Acting Lieutenant Governor, and all you beautiful stakeholders that are present today. The use of nicotine products, including vape, affects every part of the body, from the tip of the hair to the tip of your toenails. Unfortunately, one of the organs that affects the hardest is the respiratory system, the lungs. It never ceases to amaze me when I go out and about that people aren't aware of the services that Chris had just mentioned about cessation services here on Guam. It just never ceases. And I've been in this field for quite a while now. And the hospitals, various clinics, you have Grace from Public Health, you have Hannah and her crew from Guam Behavioral Health, you have Marisha from ACS, you have probably one of the most available things around is the Quit line. Yeah, use it. Spruce down your clients to give them a call. It's that easy. Everybody received this, right? So, okay, if you haven't taken it the years that we've been doing this, I can guarantee you if I went around the room here, probably each one of you have your CPR first aid, right? Well, my goal when I first started doing this was to have this also in line. It gives you the basic tools to assist somebody who is ready to quit or thinking about quitting. And just by doing that, 3 to 10 minute intervention can set them on that path. And then lastly, I want to say, it's never too late to quit. It's never too late to quit. There was a recent study that came out about a couple of months ago where one case study, he was 70 years old and he was able to quit. And the health benefits that he received at that age was astronomical. Probably the biggest one that he was able to notice was taste of food. Taste of food. On that note, thank you very much for showing up.
Thank you, Pete. I now want to give the floor to our acting governor of Guam, the Honorable Joshua Tenorio, for the reading of the proclamation. For his remarks.
But before I do, we're going to recognize our life-saving pulmonologist, Dr. Jolene Uggan. Let's help her. Okay, I'm sorry,
I agree with you. We're going to put the quit line on our clinic visits and make it part of our smoking cessation.
Yeah, and for behavioral health, can we also connect to the quit line from 988? We can? Yes. There's an option, great. Well, Hafaday, everybody. The purpose of today's gathering is to provide our community with a lot of information, but tools necessary to recognize, number one, that smoking continues to be a problem on Guam and that lung cancer is the leading cause of death. And of course, even though we have made strides over the last few decades, beginning with the banning of cigarette smoking in the workplace, and then the banning in the restaurants, and then finally the bars, there have been elements to try and make sure that we have safe environments where people are not going to have to struggle, especially those that have been at risk for secondhand smoke. In this regards, though, we do have some troubling things that are occurring in our community, where our teachers and our educational system are talking about vaping beginning in the elementary schools already. People might not believe it, or I think I know everybody in the room understand. I think our general population may not understand. And one of the things that we can do as family members, and especially those of us who are parents, are to be mindful where we keep the things in our homes. Children always look up to adults to see what's going on. And I think that what I hear from a lot of the school administration officials are that children are taking these products from home and bringing them to school. I know that there's been some great work out of behavioral health to go and make sure that our mom and pop stores and our commercial establishments are not selling cigarettes and vapes to minors. And I know that there's a pretty good, effective method that is out there to go and test this in the community. These are part of the things that we need to do to try and protect, especially our youth, who are very susceptible to smoking and to vape use. The other thing I'd want to say is that there are many people out in the community, many people here that are warriors out there to try and bring more information and education and focusing and encouraging people to get screened. So Josh, I was so happy and excited to learn about this innovation with IRI that is connecting screening and looking at different kinds of risk factors that are going to really try and identify and help people that are going to be the most susceptible to getting lung cancer and suffering from those lung diseases and such. So today we call on the people of Guam to take notice of the issues that can develop because of smoking. I think Pete was able to recognize and hopefully provide accurate information that even the vaping that has nicotine is also part of that. A lot of people misunderstand, and I know of people that are being encouraged to move from one method to another. Just know that these are very new things also, and I think the research is still out about what the true effects are going to be for those that continue to utilize and use those things. But I would just say that we really need to focus in on our youth and to make the greatest long-term impact and continue to push the rates down on Guam and also confront the reality that we continue to exceed the prevalence that is in the rest of the country. And that's a call to action that all of us must heed. And today's event is there to issue a call to action for everybody. So thank you very much and happy Friday to everybody. Sijus Masi.
Thank you so much, Acting Governor. And now I want to turn the floor to Dr. Jolene Uggan.
A proclamation of the governor proclaiming November 2024 as Guam Lung Cancer and Smoking Cessation Awareness Month. Whereas this November is our island's second observation of Guam Lung Cancer and Smoking Cessation Awareness Month, alongside survivors of lung cancer and their families, health advocates, and community partners to increase awareness of lung cancer and support those beginning or currently going through the journey to become tobacco-free. Whereas according to local data for the years 2007 to 2020, cancer of the lung and bronchus were the leading cause of cancer deaths in both males and females. Whereas tobacco smoking is a major contributor to lung and other cancers and the leading cause of preventable deaths and diseases worldwide. In Guam, 58% of adult cancers are attributable to tobacco use. Whereas tobacco-related diseases are the leading cause of pain, suffering, financial devastation, chronic ill health, and death on our island today. In 2023, the top 4 cases of death on Guam were diseases of the heart, malignant neoplasms, also known as cancers, accidents, unintentional injuries, and cerebrovascular disease or stroke, most of which are directly related to tobacco use. Whereas daily smoking is associated with nicotine addiction, in 2023, smoking prevalence and smokeless tobacco use among adults remained higher on Guam than in the mainland United States. According to the 2023 CDC Behavioral Risk Factor Surveillance System data, 18% of Guam's residents 18 and older are current smokers, which is higher than the US average of 12.1% and one of the highest rates in the nation. Whereas Guam started seeing a decline in smoking prevalence in 2007, 1 year after the implementation of Public Law 2880, also known as the Natasha Act, Guam's smoke-free public place law. That same year, the government of Guam issued a GovGuam tobacco-free policy and a request for proposal for a cessation toll-free hotline, otherwise known as the Tobacco-Free Guam Quit Line. These initiatives were followed by other policies that increased tobacco taxes in 2010, established tax parity across various classes of tobacco products in 2013, expanded the scope of the Natasha Act 2007, 2009, 2015, and raised the age for tobacco use, sales, and possession to 21 in 2017. Progressive decreases in smoking prevalence followed these policies. However, the rate of decline has not been sufficient to close the gap between Guam and the U.S. mainland. Whereas the University of Guam was awarded a $519,000 grant from the National Institutes of Health's Artificial Intelligence Machine Learning Consortium to advance health equity and research diversity, the Aim Ahead program for the AI-driven insights on risk factors from economic, behavioral, and social determinants for predicting lung cancer in Guam, ID project. This project will significantly aid in our understanding of lung cancer disparities amongst Guam's unique ethnic group and can lead to better lung cancer screening campaigns that can ultimately save lives. Whereas Guam's only public hospital, the Guam Memorial Hospital, was recently designated as an American College of Radiology Lung Cancer Screening Center that will use advanced technology to help detect cancer at earlier, more treatable stages. Whereas through broad awareness of lung cancer, health organizations across the island can transform lung cancer survival by amplifying the conversation on the importance of early detection and treatment. Whereas in 2007, the Department of Public Health and Social Services developed a toll-free hotline to help residents quit smoking. Cessation counselors or quit coaches are available 24 hours a day, 7 days a week through the tobacco-free Guam Quit Line. The American Cancer Society estimates that people who use telephone counseling have twice the success rate compared to those who do not receive this service. Whereas a regular lung cancer screening test can save lives, the U.S. Preventative Services Task Force recommends annual lung cancer screening with low-dose computed tomography, or CT, in people who are 50 to 80 years old, have a 20-pack year smoking history, currently smoke cigarettes, or have quit within the past 15 years. And whereas the Cancer Moonshot Initiative, led by the U.S. Vice President Joe Biden in 2016, inspired a global movement to accelerate progress against cancer, President Biden reignited the Cancer Moonshot in his State of the Union address, and we stand united in his commitment to cut the cancer rate by 50% over the next 25 years.
Now therefore, I, Joshua F. Tenorio, Oktumagatlahin Guahan, Acting Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim November 2024 as Guam Lung Cancer and Smoking Cessation Awareness Month. Our administration stands with all those battling lung cancer, all survivors and their families. We pay tribute to those we have lost to the disease. We recognize the dedicated organizations, agencies, and healthcare providers who work tirelessly to reduce the prevalence of lung cancer and those who provide the necessary support to lead a tobacco-free life.
In witness whereof, I, Therese M. Terlahi, Acto Segundo Mangathagan Guahan, Acting Lieutenant Governor of Guam, hereby, together with the Acto Mangatlahin Guahan, cause the Great Seal of Guam to be affixed in the capital city of Hagåtña on this 15th day of November in the year of our Lord, Anno Domini 2024.
Viva Guam Lung Cancer and Smoking Cessation Awareness Month. This will conclude our live stream event. I do want to ask our partners and friends in the room to join us.